Good evening. What action is being taken in our city to reduce the dangers posed by asbestos following the earthquakes? Well, Canterbury's Medical Officer of Health says we're potentially sitting on a ticking time bomb. So tonight, what you really need to know to keep yourself and your family safe. And Lynched starts right now. Good evening, thanks so much for your company tonight. Well, a number of residents in Canterbury believe they've been exposed to asbestos fibres during the earthquake repairs. So have they actually been put in danger, and what do we really need to know to keep yourself safe? We're here to discuss this and other health issues is Canterbury's Medical Officer of Health, Dr. Alistair Humphrey. Welcome to the show.
Good evening.
I recall you saying quite an extraordinary comment about a year ago now, I think it was, and you did say that Canterbury was potentially sitting on a ticking time bomb when it comes to asbestos-related issues. Do you stand by that comment?
I do, yeah.
Why?
We've had, at EQR's estimate, EQC and EQR, more than 35,000 homes which were not checked properly before repairs were taking place. So they are homes where we don't even know whether there was any asbestos in. At the same time, for many years now, since the earthquake, EQC have been advocating a process known as encasement, covering over asbestos damaged ceilings. When I talked about a time bomb, what I meant was those ceilings that are covered over are ceilings that an ordinary tradesman can no longer look at and say this has got asbestos in. They will drill into those, perhaps to put down lights, and only at that point, if at all, will they discover there's asbestos underneath them. That's what I meant by a ticking time bomb. That was a process we had asked, that is the District Health Board, had asked many years ago, please stop doing this. They've continued to do that.
I want to pick you up on something important you said there. You say that some houses haven't been checked properly.
That's right.
What do you mean by that, and how do you know that?
This is by EQC and EQR's, this is what they've told us. They have said in the early days following the earthquake, a lot of repairers went into houses, they started fixing things without necessarily checking to see whether there was asbestos there. Following that, WorkSafe have asked EQC, well, how many do you estimate were not checked? And EQC estimate about 35,000 were not checked. A further estimation is that about a quarter of those will have had some kind of asbestos in there that might have been damaged, so maybe about 9,000 homes. Of those 9,000, the vast majority will have had very minimal damage. So people in those homes, more than 99% of them are going to be completely safe. But they need to know that. They need some process by which they can say, well, am I safe? I think there will be a few people who may well find that work was done on their home, they moved back into their home, it wasn't cleaned up properly, and they may have been living in that home now for a couple of years without the dust having been properly removed.
Well, how would they possibly know, Doctor, if the dust has been properly removed?
The only way you can test is to carry out what's called a bulk sampling test. It requires an expert, it requires somebody to go in. This is, remember, potentially 2 years after the work was done, and think about where they could pick up fibres in the house. We have experts that work at public health, and they often look at places like backs of wardrobes or on the tops of doors which might not have been dusted, so they can find it in those places, because it does tend to get spread around quite a lot. But also, you need to know what kind of work was done in the first place. So people need to be able to go back to the repairers and say, well, was there asbestos? Could there have been asbestos there? And the kinds of questions they need to ask are, did you do any work on any stippled ceilings in my house? Was there an asbestos, or is there still an asbestos roof that could have been damaged? Were there asbestos fibre boards behind the cooker or behind fireplaces, which at some point in the past could have been damaged or were damaged during the earthquake, which you fixed? So those kinds of questions need to be put to those repairers. If the answer is yes, you did have an asbestos roof, yes, there was some work done on stippled ceilings, the next question is, well, how much was done? Was it just a small crack in one room, or was it more extensive? If it was more extensive, I believe that those householders should make sure their house gets tested properly and soon, so that they can see or not whether they were put at risk.
And there are many companies in Christchurch that can check that properly.
There are a number of accredited asbestos testers who can go in, there's one at Community and Public Health, but there are others who can go out and test your house for you. If there's a reasonable assumption that you might have been exposed, obviously it's not going to be all 35,000 houses, and we simply don't have the resource to test them all. But there will be some who should get their houses checked.
What are your concerns regarding encasement of asbestos, and what is wrong with that? Because as far as I understand, that is an accepted practice in New Zealand, isn't it?
It is an accepted practice in New Zealand, but currently WorkSafe are revising their guidelines.
Yes.
They're in the process of doing that, and I'm hoping that those guidelines will say it's not accepted anymore. Essentially what that means is if you have damaged asbestos, you can box it in some way in order to separate that damaged asbestos from the environment around you. Part of those guidelines say that if there is a risk that it might be damaged or exposed in the future, you should not encase. Now, my view is that if you encase a ceiling in a residential home, it is possible in the next 20, 30 years that there will be a DIY person or a tradesman who thinks, well, actually, yeah, why don't we have some downlights put in here? And they will drill into that ceiling without necessarily knowing what's underneath it. That puts the tradesman at risk for a short period of time while they're doing the work. It potentially puts the householders at risk for a lot longer, because if the dust isn't cleaned up and they're living in that room, they might be in there for large parts of the day, for example, they are at risk.
Now, I know you're not a tradesperson, but what is the alternative then if you don't believe encasement is a good form of containment? What is then? Is it simple removal?
We should go down what most Australian states have now gone down, and that is commit to removing where practicable. Now, we had a great opportunity following the earthquake. There were many damaged asbestos ceilings, as well as other parts of people's buildings. We should have removed it. It was an opportunity we missed in many cases. If we can remove it, we should remove it, and I'm hoping that the guidelines will push harder for removal in the future.
We need to take a break. When we come back, there's so much to discuss in terms of asbestos, some of those important public health messages we need to get across, without creating community panic. We'll discuss that. Plus, also coming up, New Zealand's binge drinking culture. Just how disgusting does it get here in Christchurch over the weekend? That's next. Welcome back to Lynched on CTV. My guest tonight is Canterbury's Medical Officer of Health, Dr. Alistair Humphrey. Doctor, let's just quickly, briefly touch on cases of asbestos and people, I suppose, seeing asbestos in their homes. You told me on News Talk ZB a couple of weeks ago you had a couple of cases where people who have been writing you emails or letters expressing concern that they feel they may have been exposed to asbestos. We're talking about your everyday tradesmen. Are you still getting those concerns? Is there that concern mentality out there for tradespeople, and what should they do?
There are some tradespeople who've already come across asbestos ceilings which have been covered over by plasterboard. Most of those that have contacted us understand the risks, and WorkSafe have been running training programs for tradesmen. They've had a number of what they call tradesmen's breakfasts, where they've had experts from New Zealand and Australia explaining what the risks are and how they can avoid them. So the tradesmen, first of all, they are aware that what appears to be a benign ceiling could have asbestos underneath it. They know about that. They also have received training on getting the best protective gear. The other aspect of it is householders. And what do householders, how do they know whether they're safe or not? Well, first of all, if your house was built since 1991, it is not very likely that it will have any asbestos in it at all.
Right.
So it's houses pre-1991 we're concerned about. is houses that have asbestos roofs. Those corrugated asbestos roofs are one type. That could have been damaged. If you've had cracks in your ceiling, you may have had some of that asbestos come through the ceilings. That needs to have been tested for and cleaned up properly if it was found. Stippled ceilings, likewise. Linoleum or lino, vinyl flooring coverings often were backed with asbestos. If they were damaged or ripped up as part of the repair process, there could also be asbestos release from that. Surrounds, fibreboard surrounds, particularly of cookers or of fireplaces, often contained asbestos. There are other types of asbestos-containing materials that may be used in houses, but those that I've mentioned are the main ones. If you think your house had that kind of thing, you need to talk about that with your repairer. If your repairer clearly told you there was asbestos there and all the right tests were done, well, you know the tests would have been followed, the cleanup would have been done properly, and you'd be safe. But if they didn't test for it, you want to ask them, well, could there have been asbestos there? How much is likely to have been damaged? And if the answer is that there was substantial damage, if it were my house, I would be saying, okay, I'm going to get a test now. I would expect my insurers to pay for it because they did the work. The test actually isn't very expensive. It's a matter of a couple of $100, but certainly that's something that insurance should pay for. Get it checked. If it's found, you need to move out of that house till it's cleaned up properly. It will be cleaned, tested, then you can go back in.
There is no register in Christchurch with data suggesting how many homes may have asbestos, is there?
Unfortunately not.
And there's no register either, Doctor, that says how many homes may have been affected by various tradesmen's movement in roofs, for example, is there?
No, the only numbers we have are the ones I've told you about. The 35,000 is an estimate from EQC of how many were not tested. The estimate of about a quarter would contain asbestos is based on their experience.
You see, various community groups are calling out for a register. They're trying to start one up themselves, but they're probably banging their head against a brick wall, aren't they? It must be impossible.
Well, the problem now is a lot of the work has already been done. So we have approached EQC in the past and said, can you give us a list of the properties where there is asbestos or where repairs have taken place? Initially they said, we can't do that because it's confidential information between the insurer and the homeowner. Subsequently they have told us, well, we don't actually know where they are at all. So even if we could give you the information, or even if we wanted to give you information, we can't. So there isn't a register. At this stage, it doesn't look like there is likely to be a register. It will not get entered on any limbs at the City Council because putting it on the limb has to be triggered by a building consent, and many of these repairs were not done with a building consent in the first place. So the fact is we are now faced with having to look at the age of our properties and think about the kinds of materials that might be in our property and then ask the question of the people who did the repairs in the first place. So there won't be a register and there's not likely to be.
Influenza in Christchurch continues to be a major problem for the hospital, in fact for most hospitals around New Zealand wintertime. Are we getting better at vaccinating ourselves? Because whenever I'm mentioning the flu injection on News Talk ZB, I get vilified for saying, get your flu injection. I get all the people coming out of the woodwork saying, oh, you know, it's bad if you're pregnant, it's got this and that in it. The amount of people spinning data at my show is unbelievable. I try to go with the expert's point of view only. So as far as you are concerned, the flu shot is absolutely safe. It doesn't have any nasty things in it. Do you get frustrated as a medical expert with the amount of misinformation there is out there?
I do get frustrated. I myself and my family get the vaccine every year, and it works well. It's certainly prevented me from getting influenza over the years. It's not 100%. No vaccine ever is 100%. But if enough people get vaccinated in our community, we will prevent the spread of this disease, which does kill people. What we have seen in New Zealand as a whole is an increase in people picking up this vaccine. They are recognising the benefits, not just the kind of man in the street, as it were, but also their employers who are saying, well, you know, if I get my employees vaccinated, it saves me money as an employer because I keep them at work. You get flu, it's a serious illness. It's a week off work. Of course, it's far cheaper for an employer to make sure their employees, they'll spend $30 to $50 getting their employees vaccinated than it is losing an employee for a whole week of work.
Doctor, who needs the flu injection the most in Christchurch, do you believe? Or would you say everybody?
I would say everybody needs the vaccination. Anybody can get sick from influenza. We do have a policy where we target those people who are most vulnerable. So they are people with chronic diseases, they are the elderly, they are children under 5, and here in Canterbury we do all children under 18 because international data shows that school children transmit the virus not just between each other but to their families, to their parents.
So the message is getting through to parents, it's best to get vaccinated than not, do you think?
I think it is.
Christchurch?
I think it's getting through to parents, they're getting their kids vaccinated. We have a relatively high coverage of children now. It's a terrific achievement for Canterbury because what we have is a generation of children now who've been protected against influenza, who perhaps themselves understand the benefits of it. Certainly their parents do. So it's become, for us in Canterbury, very much kind of business as usual. You get this vaccination, it protects you. It's not the same across the country. Our rates generally, I think, have reflected how well we've done with our vaccination campaign.
Need to take a break. At one stage you got a little bit offside with the bar owners because of your strong views on the council's proposed alcohol policy draft. We'll discuss that next on Lynched here at CTV. Welcome back to Lynched on CTV. My guest tonight is Canterbury's Medical Officer of Health, Dr. Alistair Humphrey. Doctor, in terms of the Council's alcohol draft policy, of course the liquor industry as a whole is very scared of this because essentially it means it's the one-way bar policy. At 1 a.m. you go into a bar and you try to come out, you won't be allowed into another bar. You've got some very strong thoughts on this, don't you? Because I suppose in some ways you work in the industry at the front line that sees the results of far too much alcohol.
Well, we do. Canterbury District Health Board spends an enormous amount of money fixing people up who are damaged by alcohol. And it's not just trauma. It's not just people who get assaulted, people who get raped. It's the chronic effects of alcohol as well. So we do see people with high blood pressure, for example, having strokes. Not a lot of people probably realise that what a significant contributor to breast cancer is alcohol. You know, you sometimes see young women having kind of champagne breakfasts to kind of promote breast cancer research. What they don't realise is that alcohol is actually contributing to their own risk. So yeah, I do have pretty strong views about it.
But aren't we going to be trying to punish local business owners that may want to stay open well into the wee small hours past 1 a.m? Why punish them? Why not try and get more information out to our binge drinking nation that it's personal responsibility?
We don't intend to punish them, and I think the City Council who developed this policy have been very careful to say we absolutely do not want to punish local bars. We have a vibrant and we want to retain a vibrant nighttime culture here in Christchurch. What that means, of course, is that we want people to go out during the evening, which starts at kind of 6 p.m. Now, what we know from our own data is that at least prior to the earthquakes, a lot of young people were not going out till midnight. They were preloading for 6 hours.
That's right. So we've got to change that culture first, don't we?
Absolutely. Well, it's all part of the same thing. So you cannot have control of your on licence unless you control your off licence as well. So one of the things we've been strongly advocating is pulling back sales of off licence liquor, particularly in supermarkets where the biggest increase in sales has occurred over the last 20 years, so that people actually go out in the evening and enjoy themselves. They spend money in our bars with our licensees and not on preloading, which often goes to overseas owned supermarkets.
So give me the dream scenario then for you. And so are you suggesting we increase the price of a cheap bottle of $10 wine at the countdown, or what then? Because that's the issue, isn't it? It's the preloading.
Price controls have been rejected by the government as it stands at the moment, so we don't have an option on that. What we need to look at is how we can shift the times when people drink. So we don't want people drinking between midnight and 4 a.m. We want them drinking between 6 o'clock and midnight.
But is that realistic? Because people don't work from 9 till 5 anymore. I mean, you know, the youth like to, as you say, they go out and get off their face at midnight in town. How are we going to change that, though? That's such a huge
It's
cultural
true.
change, isn't it?
It is true. They are getting off their faces at midnight. Actually, what we saw from the earthquake was the clock did shift forward.
Did it?
It actually shifted forward. People started going out earlier, partly because they had to. But what we've seen from Australian examples is that when you shift that clock forward, when you stop people buying and preloading, you have bar owners that are much happier with that. They don't have to spend as much money on expensive security late at night. I can tell you, and I have family members who work in bars, the last thing they want to be doing is working till 4 o'clock in the morning. The best bars in town and the most profitable bars are those that can generate income prior to midnight. They don't want to be chasing the drunken dollar at 4 a.m. That is not a good way to run a business. It's not a good way to keep a vibrant
Trouble is, many do though,
culture.
don't they? Because the drunken dollar is great for business, isn't it?
Well, what we've seen from the Newcastle experience in New South Wales is actually it's not that good for business. The businesses that shifted forward and were delivering a service early in the evening were actually the most profitable ones, not the ones that were pushing it back till 4, 5, 6 in the morning. So in terms of running a profitable business, you want a bar that is actually going to make money before midnight.
The interesting thing, when I was in a police car, legally, thank you, for work purposes, and I was talking to the constables on shift, and they said to me, Chris, if alcohol was banned in New Zealand, we would be out of a job. And that, to me, was a pretty big statement, but I completely agree with them, because every job we attended on that Saturday night was something to do with somebody being drunk. Whether it was violence, whether it was a sexual assault, everything was related to alcohol.
Well, I'm happy to say that not everything is related to alcohol in health, but I can agree with the policeman on the fact that particularly at the weekends, as the clock ticks around to midnight and into those early hours of the morning, that's when we see a tremendous amount of trauma, and it is related to alcohol. And what we want to do is we want people to enjoy themselves with alcohol. We don't want to ban alcohol, but what puts on licenses under pressure is the preloaded person, the person that turns up who's already had, and we know from our own data when we did surveys that people had consumed up to 8 or 9 units of alcohol before they even got into the bar in the first place.
Trying to push that culture back to 6 o'clock at night, won't they still preload at 5 o'clock?
A very good question, and I often talk. I mean, I have a good sample, perhaps a slightly educated sample, but I use the medical students, right? Medical students notorious for boozing, at least they used to be in days gone by.
Smoking?
I believe so. Not so much smoking, but certainly drinking in the past, at least. I asked them, well, what do you do when you go out? And they all accepted that, yeah, we'll have a few drinks before we go out. And I said, if the clock was shifted round, would you start drinking earlier? 4 o'clock in the afternoon? The answer from them mainly was, no, we probably wouldn't. We would actually just preload less. And that actually is what they found in Newcastle. They're still spending money when they go out, but they're not preloading for several hours beforehand.
Do you think you'll win this battle? Because a lot of money's in the alcohol industry, liquor industry.
It's a tough battle to win, but I think responsible hosts, responsible on-licensees recognise that the future lies in a profitable and vibrant industry before midnight, not after midnight. That's where the smart ones, and if you can look around town, you can see the best bars in town often are the ones that actually do have things going on well before midnight. They don't need to keep staying open to make money. They're making money beforehand. So I think we do have a good chance of winning this, and I think all the community surveys were done around all the different city councils around the country have all showed that the community themselves wants this drawn back. They are not asking for their bars to stay open all night. They actually want it pulled back. People have had enough. And certainly in the health service, we're spending far too much money. Here in Christchurch, we spend up to $100 million a year fixing people up. Yeah. That is money that needs to go into other things. It's preventable. We shouldn't be having to waste money on fixing up people who've basically made themselves ill with alcohol.
We're out of time. Interesting discussion. Really appreciate your time. Dr. Alistair Humphrey, thanks for coming on the show. Well, on tomorrow's show on News Talk to Be, that is Christchurch Mayor Leanne Dalzell joins me for the weekly mayoral catch-up on 100.1 FM. But from all of us here at CTV, have a good night.